Now let's look at this in real time. Again, start with your best parasternal long axis view and rotate the probe on the chest wall 90 degrees in a clockwise fashion so the index marker ends up pointing somewhere towards the patient's left shoulder. From this position, small rotational movements are made to optimize the circular shape of the left ventricle, and small movements to angle or tilt the probe will focus your view on the papillary muscle level of the heart. Once again, if you get lost or are having difficulty with this short axis view, simply return to your parasternal long axis and begin anew. Next, we'll focus on making an assessment of the global function of the left ventricle in the parasternal short axis. Let's start with a normal example. Observe how the walls of the left ventricle contract in unison, and there are no areas of akinesis. The circular walls of the left ventricle are observed to contract towards the center of the cavity. It may be helpful to imagine a dot or place your finger in the center of the ventricle to observe the walls collapsing in towards the center. The thick muscular walls of the left ventricle should also thicken uniformly. Note how the total blood volume in the left ventricle is not completely emptied during systole. This is normal. Now let's look at a clip of depressed left ventricular function in the parasternal short axis. It is clear that although all of the walls of the left ventricle are contracting, they do so less vigorously when compared to the normal example. The cavity of the left ventricle does not empty as much as the normal example either. The muscular walls of the left ventricle do not thicken to the same extent as the previous example. Here we have the clip of normal left ventricle function displayed next to the clip of depressed left ventricular dysfunction to contrast the difference between the two. Now let's look at a clip of severely depressed left ventricular function in the parasternal short axis. It is clear that the walls of the left ventricle are moving very little, and that the cavity of the left ventricle barely changes in size during the cardiac cycle. Note that the walls of the left ventricle hardly shorten at all during contraction. Again, here I have displayed the clip of the heart with normal function next to the severely depressed heart for easy comparison. Finally, let's look at a clip of hyperdynamic left ventricular function in the parasternal short axis. It is clear that the walls of the left ventricle are moving very vigorously. Indeed, one notes that the left ventricular cavity is nearly obliterated with the walls of the left ventricle touching at the end of systole. The difference between normal and a hyperdynamic left ventricle is clear when observed side by side. In summary, the qualitative or eyeball method is the preferred method for determining left ventricular function using point-of-care ultrasound in the emergency department or the intensive care unit. The parasternal short axis view of the heart is a great view when assessing left ventricular function. Determining the function of the left ventricle during shock states will provide vital information and will aid in guiding management of critically ill patients in both the emergency department and intensive care settings.